Hey guys, in this video I'm going to be looking into contact precautions in Japanese and some of the main Japanese vocabulary and practices used for infection control in Japanese healthcare. So let's get straight into it. I'm first covering the word transmission-based precautions, as contact precautions is just one type of transmission-based precaution. So the word for transmission-based precautions is 感染経路別予防策. I've broken down the kanji of the word to make it easier to remember and put the word together in your head. So the first word is kansen, which is transmission or infection. The next word is keiro, which means route. The next kanji following is betsu, which in this context means according to. And the last word is yobosaku, which means precautions. So putting the word together, it is kansen keiro betsu yobosaku, or transmission route according to precautions, so precautions based on the transmission route, which is transmission-based precautions. Next, we look at the words for the three types of transmission-based precautions. So the first is contact precautions, which is the one we'll focus on in this video, and the word for that is sesshoku yobosaku. There are also droplet precautions, and the word for that is himatsu yobosaku. And there are also airborne precautions, which is kuki kansen yobosaku. So contact precautions, as we just touched on in Japanese, is sesshoku yobosaku. Breaking the kanji down, we have the word for contact, sesshoku, combined with precautions, yobosaku, together making sesshoku yobosaku, or contact precautions. So a very literal, straightforward translation there. Now let's look at the route of infection, or how you can get infections that contact precautions help prevent. So the word for route of infection is kansen keiro, which we touched on earlier as it makes up part of the word for transmission-based precautions, kansen keiro betsu yobosaku. So one of the routes of infection is kansen gen ni chokusetsu sesshoku, or direct contact with the infection source. I've written down the hiragana under the kanji to help read the kanji and have underlined where the kanji is in correlation to where the hiragana translation is in the sentence. The other route of infection is 患者に使用した物品や環境表面と間接接触する, or indirect contact through using affected items and environmental surfaces. Next, we're going to look at the pathogens that require contact precautions, and the word for pathogens is byogentai. Breaking the word down, it is made up of three kanji, the first being byo, which is for disease or illness, gen, which is the kanji for origin, and tai, which we often see for body, but in this context means substance, together making byogentai, or disease origin substance, which describes the meaning of a pathogen. Now, one of the main types of pathogens that require contact precautions are multi-drug resistant bacteria, and the word for that is tazai taiseikin. Breaking the word down, we have the kanji ta for multi, zai for drug, taisei for resistant, and kin for bacteria. So altogether making tazai taiseikin, or multi-drug resistant bacteria. So now we have some examples of multi-drug resistant bacteria, and before I get into it, I'll just read the advice written in the bottom of the slide. The English acronyms are generally used when referring to these bacteria in Japan. Just thought I'd say this in advance, as some of the Japanese names for this are a bit of a mouthful and can be difficult to say and remember. So as the English acronyms are commonly understood, I'll just quickly go through them. So we have MRSA, which in Japanese is Methicillin Taisei Oshoku Budokyukin Kansenshou. We also have VRE, which is Vancomycin Taisei Chokyukin, and MDRP, which is Tazai Taisei Ryokunyokin. Now just some other pathogens that also require contact precautions. So we have rotavirus, which is rotavirus, norovirus, which is norovirus, adenovirus, which is adenovirus, tanjun herpes virus, or herpes simplex virus, and Clostridioides difficile, which is Clostridium difficile, or C. diff. Next, we have patient arrangement, or患者配置, which is how patients requiring contact precautions are housed in hospitals or healthcare facilities. So the policy for patient arrangement in regards to patients requiring contact precautions is 個室または集団隔離, which means private room or group isolation. So patients requiring contact precautions have their own room or in a shared room with other patients requiring contact precautions to prevent infecting people that aren't infected. Now we'll look into personal protective equipment or PPE required for contact precautions. I'll first break down the word for PPE, which is kojin bogogu. Breaking the word up, we have the kanji kojin, which means personal, bogo, which means protection or protective, and gu, which means equipment, making kojin bogogu, or personal protective equipment. So another straightforward translation there. So we'll now look into the PPE required when looking after a patient requiring contact precautions. So when entering a room or nyushitsuji, we need to be wearing a mask, which is masku, gloves, which is tebukuro, and a gown, which is gaun. And for when leaving the room, it says 退出時に手袋、ガウン等を脱ぎ、手指衛生を徹底する, which in English is when leaving the room, remove gloves, gowns, etc., and thoroughly conduct hand hygiene. Next we have equipment, and the word for that is buppin. So in regards to equipment, 聴診器、体温計、血圧計を患者専用とする, which translates to patients have their own stethoscope, thermometer, and blood pressure machine. So patients have their own equipment to reduce the spread of infection. Next it says, ベッドサクと患者が触れるものは1日1回以上消毒を行う. This translates to disinfect things patients can touch, such as bed rails, at least once a day. And finally, we have patient transfer, or 患者移送. So when a patient is to have to leave the room or be transferred somewhere for whatever reason. It says, 室外に出る場合は十分な手指衛生と背筋部位の被覆を行う. This translates to, if to leave their room, practice sufficient hand hygiene and coating of bacteria sterilization. So essentially, there needs to be thorough hand hygiene and disinfecting of areas that may have come into contact with the patient. It also says, 使用した移送具は消毒し、リネン類は交換する. This translates to, disinfect any equipment and change any linen used by the patient. So that's the end of the video. I'll look into putting out videos on the other transmission-based precautions, as well as other topics down the line. But for now, thanks for watching.